In this video, we're going to get to the root of how adjusted production is correlated to new patients. So, what you'll notice about root data is it's so easy to dig into the data. You'll start noticing little correlations in how one metric affects another metric. So, you can really target these high leverage data points to boost revenue for your practice. So let's go ahead and look at adjusted production for the current month and new patients right over here. So not doing so hot right now, but let's look at the previous month. And we have adjusted production, 169,000, not bad, and new patients, which is 140. So that is up versus the previous month. So we had 99 before that, we had 140 last month. So we're trending in the right direction, but let's dig into the data really quickly and figure out exactly what is going on with our dental practice. Tell me about my adjusted production trend the last several months. Let's see what root data says. And then we're going to correlate it with. So here's your adjusted production for the last several months, January. So we're trending upwards, which is great. Strong upwards trend. We're about midway through the month, and it looks like we're behind last month's pace, which isn't good, but it looks like 137,000 projected for this month, which would put us above January and Feb, but below March. So this is good. So tell me about my new patient trend. Okay, so our new patients are going up. March was your strongest month with 129 new patients, well above the 50 plus benchmark. February dipped. Great. Okay, so how is adjusted production and new patients correlated? The Pearson correlation coefficient between adjusted production and new patients is 1, a perfect positive correlation. This means that as a new patient volume increases, adjusted production increases in lockstep. Here's the underlying data. Adjusted production from January to April, 474,394 new patients. So mixed. So new patients are a primary driver of your production. The correlation is as strong as it gets. Every NP you bring in directly translates to revenue. February is the one slight exception. So I want to see, to understand how increasing my patients by 50 will affect my adjusted production. So let's just see if we increase our new patients by 50. So new patients, obviously that is a marketing play. So we'll have to find ways to bring in new patients into the practice. But let's just figure out how that affects our bottom line so we can plan accordingly and budget and spend the proper amount of money on marketing. Your adjusted production per new patient over the last 3.5 months is $1,600. So if for every new patient we bring in, that's $1,600. So let's see, simple back. So if we add 50 new patients in a given month, we would add 80,000 in additional adjusted production. Okay, so, and that's just, that's the average. So some of these could be worth 5,000 per new patient. We don't know that. That's the average. Some of them could be worth 500 or 1,000. We just don't know. So it's asking me if it wants to look at your appointment utilization. Yes, let's see it. So let's see if we can absorb that growth. Are we prepared? That's a very good question. If we get a bunch of new patients, can we properly get, help them? Basically, we don't know that. We want to make sure that we're set up, our processes are set up to basically facilitate growth into our practice, right? Where there's room to grow. 11 a.m. to noon are underutilized. 4 p.m. is light. Cancellation rates are high for Dr. Avery and Dr. Blake. Wow. Okay, so this is interesting. So we want to look at what's going on here. Can we absorb 50 more NPs a month? That's 2 to 3 extra appointments per working day. So if we tighten up cancellations, fill these gaps, and ensure Dr. Avery isn't overloaded, we can do 50 NPs a month. Okay, so if I want to fix that, let's just say I fix that, then I want to spend on marketing after that. What can I spend per new patient? What is a reasonable amount to spend per new patient on marketing to get them in the door? So let's figure out, what is it? 300 bucks, 500 bucks, 700 bucks. The average is 1,500 ish. So some of them are going to be worth less, some more. So we want to leave some room, obviously. So our collections per new patient is $1,200. How to think about marketing per NP. So max spending, most dental practices target CPA. So 64, aggressive. Okay. So 100 to 150 per new patient is reasonable. That gives you 8 to 12x return on every dollar. So this only captures the first few months of revenue. A retained patient generates revenue for years. The lifetime value is typically 3 to 5x the first year value. No, that's it for now. Okay, so thank you guys for watching. That's basically how you can look at how different metrics are correlated and affect your revenue in your dental practice. Thank you so much for watching, and see you next time.